Hi there. Welcome to Anonymity 1D. My name is Alex. My son, Miguel, was recently diagnosed with type 1 diabetes.
My name is Lisa. I am a diabetes educator and also have type 1.
Hi there. My name is Kelsey, and I am a mental health counselor. In this video, we learn what anxiety is, ways to manage it, and when to reach out for support from a mental health provider. Please remember that this is for educational purposes only and is not meant to replace your doctor or care team.
Hello, Miguel and Alex.
Hello.
Hello.
Alex, you scheduled to meet today to discuss some of the concerns you've been having about diabetes. What's been concerning lately?
I think Miguel and I both have been pretty nervous in trying to figure out all this diabetes stuff. Right, Miguel?
Yeah. It feels like I have butterflies in my belly and sometimes my head hurts.
And when he tells me that, I check his blood sugar and it's usually fine. But then my worries increase.
I'm glad you are checking Miguel's blood sugar when he feels off. Miguel, when do you feel like there are butterflies in your belly?
When it's time to take insulin or change my sensor. After those things happen, the butterflies go away.
Sounds like Miguel is experiencing some anticipatory anxiety about these new health regimens like taking insulin or changing his CGM. That's totally expected. Alex, you've mentioned to me before that you are worried about diabetes. How do you think these worries changed as more time has passed since the diagnosis?
They seem to be getting worse. I thought by now, after getting into a routine with diabetes, that I wouldn't be so worried anymore. But I'm not. It's like I immediately think about the worst-case scenario and then can't get my mind off of that.
That sounds hard. Do you remember meeting my friend, Kelsey, after school? Her office is here in our clinic, and part of her job is to drop into patient appointments and provide consultations about mental health.
Oh yes, I remember Kelsey. Is she here today? If so, it would be great to talk to her about this.
Yes, Kelsey is here. I'll be right back with her.
Hi, Miguel and Alex. Good to see you both again.
Hi, Kelsey.
Hello.
Kelsey, I'm glad you're here. Miguel and I have been nervous about some diabetes things. Well, probably more me than him.
What diabetes things are you feeling nervous about?
Mostly about lows. Catching them, preventing them, treating them, not hearing the CGM alert, the CGM being inaccurate.
Those are a lot of valid worries to have, and all are a part of diabetes management. For people with diabetes, and caregivers to those with diabetes, being aware of low blood sugar is required for safety.
Okay. So it's not a bad thing that I'm so worried?
No. Our brains are designed to have all kinds of thoughts and feelings. Worries are just thoughts, and all people have worries sometimes. Anxiety is just a feeling, and all people feel anxious sometimes. If we didn't have these thoughts and feelings to an extent, then our safety could be compromised. It starts to become troublesome when the worries or feelings of anxiety are beyond what we can manage on our own, take up too much space during the day, or lead to harmful behaviors.
There are some days when one worry turns into several worries. It can be harder to concentrate on anything else when my mind is racing. Then I remind myself that Miguel is doing really great with everything. I'm so proud of him, and we are definitely in more of a routine and finding our rhythm now with diabetes.
Both you and Miguel are doing really great with everything. As Kelsey mentioned, feeling anxious and worried are normal human experiences. That doesn't mean they feel good, though. I've had experiences of really intense anxiety about low blood sugar myself, so I know how it feels and what it's like to recognize when it's time to reach out for help.
Thanks, Lisa. So what did you do?
Well, I started mental health therapy when I realized that my anxiety about low blood sugar was preventing me from being as active as I'd like and going out to restaurants with my friends. I was spending a ton of time glued to my CGM when I didn't need to be, and sometimes I wouldn't take full insulin doses out of fear of going low later. All of these things really decreased my quality of life. Therapy helped a lot and gave me tools that I still use today when I notice a worry or start to feel a little anxious.
Do either of you have any tips to share for what to do when feeling anxious?
What's been helpful for me is to check the facts. When I'm worried about a low blood sugar happening, I first check to see if I am actually low. If I am, then I treat it. If I'm not low, which is most of the time, but still worried about going low, then I continue to check the facts. This could include asking myself when was the last time I ate or drank, how much insulin is on board, and how active I have been or plan to be. If any of these facts support my worry about a future low, then I make sure I've got what I need to treat it if it does happen.
I like this idea of checking the facts to see if there is enough reason to even be worried in the first place.
Exactly. And if there is, then thank your brain for caring about lows, being aware of them, and keeping you safe. Then treat the low. If the facts don't support the worry, remind yourself that a thought is just a thought and it's not necessarily the truth. Always have what you need to treat a low. And if you're worried about a low happening, remind yourself that you have what you need to get through it.
Sometimes the hardest part is waiting for the blood sugar to rise after a low has been treated. While I'm waiting, my heart is pounding and my palms are sweaty. What are some ideas for getting through the waiting period without feeling worse?
Let's take the example of when Miguel's blood sugar went low at the park when we met last time. Always take appropriate action first, like treating and monitoring. It's important to find a balance between checking the blood sugar and waiting. Checking the CGM or doing a finger prick every few seconds is not going to be helpful. Rather, giving a few minutes for the number to start to rise is more realistic. Remember that it takes time. Your anxiety might start to decrease on its own as time passes. I also like to scan through my body and notice how I'm resting, like with my feet on the floor or where I'm sitting, to help ground me when I'm anxiously awaiting the blood sugar to rise. You can also try taking some deeper breaths or tensing and releasing your muscles to help relax feelings of anxiety in your body.
Lisa, thanks for sharing your experience. Miguel, when you have a low blood sugar, do you ever feel nervous?
No, not really. When I'm nervous, I have butterflies in my belly like before taking insulin or changing my CGM. Sometimes my head hurts too. The butterflies aren't there when I'm low. I'm just shaky and my legs are tired.
You have a lot of awareness of what you are feeling in your body, Miguel, and that's great. Being curious about our bodily sensations can help us check in with ourselves and be able to recognize what our needs are. Sometimes low blood sugar and anxiety can have similar symptoms, so it's important that each person identifies and is able to recognize what their symptoms are connected to, like low blood sugar or anxiety.
What can I do when the butterflies are there?
You can try taking some deeper breaths. Pretend like you're smelling a really good candle when you breathe in, and then blow out the candle's flame when you breathe out. Is there a smell that you really like?
Oranges.
Awesome. You can even close your eyes and pretend that the candle is orange and that it smells like oranges. Alex, you can also experiment with some ways to make the insulin injections or CGM change more fun and less anxiety-provoking for Miguel. Some kids like to listen to their favorite song or have a TV show on in the background. If there is a special toy or stuffed animal that can join you for insulin injections or site changes, that can also bring some comfort. Taking insulin and changing the CGM will get easier over time. For now, you're encouraged to find ways to bring some ease to the process.
These all sound like great ideas to try. Let me see if I can recap. When I find myself worried or anxious about Miguel's diabetes, I should first take appropriate action. The anxiety may decrease on its own. Scanning my body, noticing how I'm resting, like with my feet on the floor or where I'm sitting, can help ground me while I am waiting for Miguel's sugars to respond. Deep breathing and tensing and releasing muscles can also help with relaxation.
Anyone can experience anxiety at any age. There is no single cause of anxiety, rather, there are interactions between biological and psychological factors that are suggested to contribute to anxiety. Biological factors may include differences in neurotransmitters and genetic components such as a family history of anxiety. Psychological factors could include personality traits, pre-existing mental health conditions, ongoing stressors, or experiences of trauma. Research has found that people with diabetes are at an increased risk of anxiety compared to the general population, so it is important to prioritize mental health as part of your diabetes care. As Alex shared, worries are a big part of anxiety. Worries can be about any topic such as health, work, school, and relationships. For some people, anxiety has somatic signs like the muscle tension and nausea that Miguel described, or sweating and a pounding heart like Alex described. Additional signs of anxiety may include feeling on edge or restless, getting tired easily, difficulties with focusing or noticing that your mind goes blank, irritability, and difficulty falling or staying asleep. We all have worries at some point, and having worries can be protective to ensure that we are making safe choices. However, when we experience consistent worries across multiple topics that seem to be ongoing, out of proportion to the context, difficult to control, lead to a lot of difficulty in daily life, or cause us to behave in unhealthy ways, then it is recommended to reach out to a mental health provider like Lisa shared she did. If you are struggling to manage your worries or other mental health symptoms effectively on your own, consider getting connected with mental health services. You could talk to your PCP or endocrinologist or any healthcare provider to see if they can refer you to mental health services, or do your own search for mental health providers that you would like to work with.
Thanks for joining us today, Kelsey.
Yes, thank you. It's a relief to know that feeling anxious or having worries comes along with being human. It was also helpful to know that there are coping strategies and resources available to manage anxiety.
That's right, Alex. The first step is being able to recognize when we are feeling anxious and then how it impacts us, especially in the context of diabetes management. When we are able to identify that anxiety is present, we can use our coping strategies to manage it.
Everyone has different ways to cope, so it's important that you find healthy ways that support you and your needs. There might be different coping strategies for different contexts in which you feel anxious, like before doing an insulin injection or waiting for low blood sugar to rise.
And remember that if it seems that the anxiety is beyond your control or having major impacts on your daily life, it may be useful to reach out to a mental health provider to start therapy. There are several different types of therapy for anxiety management, so you can work with your provider to choose the approach that is best suited for you.
After our conversation today, I'm already feeling less nervous about it all and definitely more hopeful.
That's great to hear. We will continue checking in and let us know if additional diabetes concerns come up. I'm glad you came in today.
I'm glad we came here today too.
I agree, Miguel. We've got this.
Through this playlist, we will learn what mental health is, common mental health challenges that people with diabetes experience, and strategies to support mental well-being. To learn more, check out the resources in the video notes.
Please remember that this is for educational purposes only and is not meant to replace your doctor or care team.
Don't forget to like and subscribe to our channel. Thank you.